Hi everyone, it's Dr. Dave coming back to you with a couple of thoughts on a few issues I saw this last week in the office. So COVID antibodies is a really hot topic right now. As we all know, antibodies are proteins our body makes to help fight off infections. And in particular, when we receive a COVID-19 vaccine or we have COVID-19, we develop antibodies. And antibodies are a good thing because they will help fight future infections or prevent severe infection if you are exposed to a particular virus like COVID-19. But here's the issue, and we have to be very clear about this. We do not know at what level of COVID-19 antibodies we have protection. So is it a level of 250? Is it a level of 500? Is it a level of 2,000? Now, there are some small preliminary studies that might give us a little guidance, but the truth is we simply do not know. And I do feel that it's a very slippery slope. It's actually, I think, potentially dangerous if we start testing people's antibodies. Because if you have an antibody level, and I'm just throwing numbers out, just relative numbers, of 500, I don't know if you're protected. I don't know what your risk of having another COVID-19 infection is, or if you had the vaccine, how much longer you're protected for. The one thing we do know, and I'm seeing this in my office time and time again, is that you really should consider getting the booster 6 months after your last vaccine. I'm seeing this a lot because, interestingly, I do see people who have had the vaccine, the second dose, and they're a little bit outside of that 6-month window, and they're getting reinfected with Omicron or Delta. So we have to be vigilant that once you're at this 6 month or beyond, please, please, please consider getting the booster. So going forward, I do think eventually we will know at what level of antibodies we will have protection, but I don't think we know it now, and I don't think it's helpful to have your COVID-19 antibodies checked. Okay, one last thought. There was a recent study in a cardiology, on a cardiology website, it's a preliminary study, it hasn't been published, that looked at something called PostAcute Syndrome in COVID-19 patients. Now, this is really concerning. There is this condition called long hauler syndrome. And basically what that is it's people who've had COVID who months and now even years later still have symptoms. So they looked at 126 patients. Average age was young, it was 44 at 5 months after having COVID-19 infection. Now there was a range, some had mild, some had severe. But here's the thing, 23% of this population had some cardiac involvement. Most common was a cardiomyopathy, a weak heart. People had blocked arteries, they had arrhythmias, they had various symptoms including shortness of breath, chest pain, palpitations, and this is 5 months after being infected. The remaining 77% were not found to have cardiac involvement, but they still had fatigue, shortness of breath, elevated heart rate. Now, this is not to be conclusive in any way, but it's just an idea that, we focus so much on deaths from COVID, and there have been so many, 800,000, but we also need to focus on the fact that even if you don't die from COVID or end up in the hospital, you run the risk at a relatively young age of developing long-term symptoms. Okay, everybody, get vaccinated, get the booster. Until next time, this is Dr. Dave.